Hello, many of us have swollen legs with swollen veins, but we really don't know what this is. It's called DVT, deep venous thrombosis. So, deep venous thrombosis is, I'll not call it a disease, it's more of a condition whereby clots tend to form in our veins, especially the leg veins. This is where we tulaba nga mu bigere byaffe emisuwa gyereeze gizimbye there. In fact, in brown people they are even visible. You will see a peak below that shows it. So, how do I know that I have DVT, deep venous thrombosis? What are the signs? First sign is swelling of those legs. Second sign is feeling pain when you've sat for long. Let's say today you know amagulu galinga agasanyaladde. Then also which other sign? Basically, there are those signs. Then also visible veins. We can call them viscous veins. You're seeing your veins are visible on your legs. So those are the few signs you can see and identify that, oh, I might be having what? DVT. So what are the causes and risk factors of this DVT? Number one cause is sitting for long or immobility. This is when you sit in the car for long, you stand for long, you do everything for long. These veins tend to start swelling and forming clots since there is no enough blood flow back to the brain, or from the legs to the brain. Another cause is like genetics or family history. If you have someone in your family that had DVT, you're also at a high risk of attaining it. So you should take the cautions that follow it. Another cause or risk factor is cancer. There are some types of cancer that come with reduced blood supply to other body organs. So basically that DVT comes with reduced venous return, reduced blood supply, ebintu webityo. It is more of a saturation thing. Another cause is surgery or trauma. There are certain kinds of surgery, especially surgery of the legs, can also cause DVT. Another cause is age. People like, let me say, someone above 60 years is at high risk of attaining DVT. It comes with age. Kizibu kyakwewala emyaka gye gigenda gikola ki? Mujjukire emyaka gye gigenda gyeyongera ne organs zaffe zigenda zikula mu kula nga zinafuwa. So it also comes with age. Basically, zezo ki causes ne risk factors. So how do we, if I see the signs and neglect them, what happens next? Like, what are the complications of this DVT? Number one complication is pulmonary embolism. Remember I told you with thrombosis, a clot is formed, a blood clot. I believe you've heard of those things whereby they say he got a clot on the heart, clot on the brain. It's the same thing like having a clot in the leg. So that clot can move up to where? To the heart, to the lungs, anywhere it feels like it can go, if not treated and managed. This thing is life-threatening. Naye ffe just ebintu ebimu tubiraba ne tubireka awo. Bwe waba tewali bulumi tetuteera faayo. So another complication that we are likely to get is some people, the legs tend to swell a lot and then they fail to move again. Ekitegeera n'abeera nga takyasobola kusitukawo, we tuwulira ng'oli agamba asanyaladde amagulu. So what are the solutions to this? Number one solution is we have compressing socks. Compressing socks are available at LP Wound Care. We have them. They are of different types. Waliwo ezikwata ennyo, waliwo eno material ya cotton, then there is also another material. So here are the uses of those compressing socks. I know many of you bazibagulira oba bazibawa, but then you don't know their uses. I'm going to also talk about their uses at once in this video. So number one use is they improve circulation. Remember these socks, they help compress those veins, encouraging them to push, they cause pressure on those veins to push this blood back to the brain. Mukitegeera, jjukira wali eri oba oyimiridde amagulu gaba stuck awo, veins ziba oba relaxed, let me call it that way, ziba relaxed, but these compressing socks compress those veins, causing the pressure on the blood vessels to do what? To push blood where? Back to the brain and the heart. Ekirala, these compressing socks for those people that do athletics, ziyambako okubeera nga tokola ki? Tokoowa mangu. Obeera tokoowa. Zikendeeza muscle pain, those muscle stress, they reduce on the stress that you would have caused on your muscles since omusaayi guba gutambula bulungi. Remember these muscles pain whenever they are relaxed for long. Ideally muscles are supposed to be a bit what? Active. That's why we also do what? Physiotherapy. Especially to those people that are bedridden. Kubanga muscles ziba at rest, muscles ziba relaxed. That's why they tend to get pain. Biki ebyo byonna byonna, that's why they come in. So ekirala, zino compressing socks ziyambako ku bantu abafuna edema. Remember also edema comes to reduce blood supply, okubeera nga tewali backflow, backflow y'omusaayi, whereby water tends to leave the veins and move out to the what? To the tissue. Then we see it through swelling. Edema ideally is just a swelling. So compressing socks help in that. Another use of these compressing socks is they help those people with varicose veins. Varicose veins naziba nnyonnyodde gye emisuwa girabika egiba kungulu. Then they also help those people that stand for long for the same reason, to prevent what? DVT. Then also those pregnant people that tend to get DVT, the solution I could give them other than compressing socks is to elevate their legs at night or when at rest. Basically byebyo DVT bekola ki? DVT, other solutions for DVT, we have surgery, we have walking exercises, oba physiotherapy for those legs, then surgery, compressing socks, we have massage or physical exercises for that affected part. Byebyo munnaye. Thank you for listening. I remain Mr. Pauline LP Wound Care. Love you. We look forward to receiving your orders for compressing socks. Thank you.